Fellowship of the Australian College of Rural and Remote Medicine defines you as a generalist practitioner who has the skills, confidence and the attitude to practice safely anywhere in Australia, particularly in rural and remote locations, solo or in a team, as a leader or collaborator. With Fellowship of ACRRM, you're entitled to recognition as a general practitioner with Medicare, with access to A1 rebate items, and to recognition as a specialist general practitioner, which enables you to work unsupervised as a general practitioner anywhere in Australia. The broader base of professional skills and competence required by Fellows of ACRRM is developed and verified in the college's Vocational Training program. The ACRRM primary curriculum describes the standards, learning outcomes and certification required for fellowship. Vocational Training for Fellowship of ACRRM has 3 stages of learning and experience. Generally, the program will take a registrar 4 years to complete. The program may be shortened for doctors who receive recognition of prior learning, or RPL. This is where the college agrees that a doctor's work experience is relevant to the curriculum.
I'd been working as a doctor for 6 to 7 years before entering into the training program, and ACRRM recognised those past skills I'd accrued over that time.
And they've also accepted to look into crediting some of the training that I've already done in the past, some of my surgical training, etc., so that it shortens the time of training.
I was fortunate enough to get 3 years recognition of prior learning towards my fellowship.
They've been very friendly, and they've also been very helpful in assessing things in a logical fashion, which I found very simple. And it's not always the case sometimes when you're dealing with fellowship colleges.
ACRRM encourages you to pursue learning opportunities that are of special interest to you. This opportunity to tailor training is designed to help maintain your interest in training and match your skills to your current or future career direction. You can start on an ACRRM vocational training pathway after completing 1 intern year. You apply for a government subsidised place with Australian General Practice Training, AGPT, or the Remote Vocational Training Scheme, RVTS. AGPT and RVTS call for applications once a year, usually in May or June. The college also offers places each year on the ACRRM Independent Pathway. This is a full fee pathway and is best suited to experienced doctors who prefer self-directed learning. On any pathway to fellowship, you need to set up a learning plan in consultation with your training provider. You can do this online with the college's education and training platform, Romeo. This secure portal allows you to record and track your training to fellowship and beyond into professional development. A doctor training towards fellowship is referred to as a registrar. The Fellowship of ACRRM begins with core clinical training. This stage is 12 months, working in a hospital accredited by ACRRM, where you complete required terms in general internal medicine, general surgery, paediatrics, emergency medicine, obstetrics and gynecology, and anaesthetics. This should provide you with sufficient clinical cases and opportunistic learning to form a good foundation to begin work in rural and remote practice. When you have completed your core clinical training, you can choose to begin either or both of the other 2 stages. Primary rural and remote training comprises 24 months in rural or remote settings accredited by ACRRM, such as a hospital, general practice, Aboriginal Medical Service, Royal Flying Doctor Service or community centre. This will build your clinical and procedural skills in the rural and remote context. You may choose to complete your primary rural and remote training in one location, enabling you to build a strong relationship with colleagues and your community. Alternatively, you may undertake your primary rural and remote training in 2 or more locations if that will better match your posting opportunities or your career plans. The other stage is advanced specialised training. This requires 12 months training in one of the 10 disciplines specified by the college: Aboriginal and Torres Strait Islander health, adult internal medicine, anaesthetics, emergency medicine, mental health, obstetrics and gynecology, paediatrics, population health, remote medicine, surgery. Advanced Specialised Training is an opportunity to extend your skills and knowledge in one discipline area beyond what is required in the primary curriculum. This advanced skill will enable you to contribute to the specialised medical services in your community. Advanced Specialised Training disciplines have individual curricula and assessment requirements. As mentioned earlier, you can complete your Advanced Specialised Training before, during, or after undertaking primary rural and remote training.
So I did my post-intern hospital year in a combination of public health and emergency departments. Then did a year of primary rural and remote, did my advanced skills year, and then when I'm back now doing my final year of primary rural and remote, sitting my exams this year, and fingers crossed we'll have completed my training by January next year.
Whatever the order of your training, all stages must be undertaken under the guidance of supervisors accredited by ACRRM and in training posts accredited by ACRRM. Training also includes completing 4 modules from the college's teaching and learning resource, Rural and Remote Medical Education Online, often referred to as ROMEO. Your training must also include a minimum of 2 courses in emergency medicine. The assessment of registrars is conducted at intervals throughout training. This stage process does away with the pressure of one final exam and provides you with regular feedback and encouragement. The college uses a number of assessment types, reflecting the multifaceted character of rural medicine. There are traditional types, such as multiple choice questions and logbooks, as well as assessments by medical colleagues and patients. Wherever practical, the college conducts assessment within your local community. We use a mix of online exams and video conference technology.
I've done my exams up here. I haven't had to leave Thursday Island to go and undertake examinations. I had to walk 200 metres to my multiple choice question down the road. I had to walk 500 metres down to the hospital to do my stamps exam, as opposed to taking 2 aeroplanes, ferry rides and travelling for a whole day to undertake an exam.
But it certainly is convenient for us as trainees not to have to travel and take, potentially time out of work or professional development leave to go and do exams.
I don't know of any other assessment process that's more flexible than ACRRM's. ACRRM's assessment process allows people to do their MCQs in their hometown, allows them to do their stamps in their hometown, allows them to do their mini CX in their own town. I don't think any other college has that flexibility, so ACRRM's really setting the way.
You can go and do your exam in the morning and be back for lunch, and that's been a real important to me anyway.
There is a separate short video on the ACRRM assessment process. When the mandatory requirements are met, you apply for completion of training. When this is granted by the college, you are awarded Fellowship of the Australian College of Rural and Remote Medicine. With Fellowship, you are entitled to Vocational Recognition by Medicare and to work unsupervised as a general practitioner anywhere in Australia. You may also work in a range of other settings, such as hospitals, retrieval medicine, fly-in fly-out locums, military postings, foreign aid programs, and expeditionary teams. You can use your fellowship qualification to gain positions in academia and on advisory bodies. And of course, you are entitled to use the post-nominal ACRRM. To maintain your Fellowship of ACRRM, you need to maintain membership of the college and to continue your medical education through participation in the college's Professional Development Program, or PDP.
It's still a cradle to grave medicine. It's still very rewarding. It's still wonderful to be part of a community. It's still good to be looking after complicated patients by yourself. There's very good backup now. There's very good training for you. You're going to go out into it really well trained. It's very easy to be independent. It's a wonderful lifestyle and a wonderful way of practicing medicine.
If you want job satisfaction, challenge, a range of skills, exercise a range of skills, stretch yourself, find out what you're capable of and find out who you are, then rural practice is for you.
If you relish a challenge and value professional independence, consider the lifelong scope and variety that Fellowship of ACRRM offers you. Big cities and small towns, coastal and country, temperate and tropical, solo or in a team, self-employed or on staff. Train for fellowship with a college that shares your passion for medicine and be rewarded every day for life.